Have you noticed your clothes fitting looser in all the wrong places? That sweater that used to hug your shoulders now sags awkwardly. Those pants that were snug around your thighs now bunch up with extra fabric. This isn't just normal aging, it's your muscles literally vanishing before your eyes. And there's one critical vitamin that could stop this terrifying process in its tracks. A groundbreaking 2024 study from Johns Hopkins revealed that 72% of seniors over 60 are severely deficient in this single nutrient, and it's causing them to lose muscle mass at 3 times the normal rate. What's even more alarming? Most doctors aren't testing for this deficiency until it's too late, leaving seniors like you vulnerable to devastating falls, fractures, and loss of independence. Let me tell you about 78-year-old Margaret from Ohio, a former schoolteacher who loved gardening and playing with her grandkids. Over the past 2 years, she noticed she couldn't lift her watering can like she used to. Kneeling to pull weeds became impossible. Even getting up from her favorite armchair required pushing off with both hands. Her doctor dismissed it as just part of getting older. But Margaret knew something was terribly wrong. Then she met a geriatric specialist who ordered one simple blood test that changed everything. Her vitamin D levels were at a shockingly low 11 nanograms per milliliter, far below the 40 to 60 nanograms per milliliter seniors need to maintain muscle mass. After just 8 weeks on a proper vitamin D regimen, Margaret could kneel in her garden again and lift her toddler grandson without her arms shaking. Her muscles weren't gone forever, they had just been starving for this essential nutrient. What's happening inside your body right now is both fascinating and frightening. Vitamin D isn't just for bones, it's the master key that unlocks your muscles' ability to use protein. Without adequate levels, no matter how much protein you eat, your muscles can't hold onto it. A 2023 NIH study proved that seniors with low vitamin D lose muscle 3 times faster than those with optimal levels. But the damage doesn't stop there. Vitamin D also protects the myelin sheath, the protective coating around your nerves that carries signals from your brain to your muscles. When this insulation breaks down, as it commonly does in seniors, those vital messages slow down or get lost entirely, leaving your muscles confused and weak. That's why you might feel like your legs don't respond as quickly as they used to, or why you sometimes lose your balance for no apparent reason. If you're taking certain common medications, you could be making this problem much worse without even realizing it. Acid reflux drugs like Nexium or Prilosec, which millions of seniors take daily, can block vitamin D absorption by up to 60%. Statins, prescribed to nearly half of adults over 65, interfere with vitamin D metabolism in ways that accelerate muscle loss. Even common steroids like prednisone, often given for arthritis or respiratory issues, can deplete vitamin D stores at an alarming rate. The tragic part? Most doctors don't warn patients about these dangerous interactions, leaving seniors to wonder why they're getting weaker despite doing everything right. Here are 3 telltale signs that your muscles are screaming for more vitamin D. First is the chair test. If you can't stand up from a seated position without pushing off with your arms, that's not normal aging, that's vitamin D deprived thigh muscles failing you. Second is the grocery bag struggle. If carrying a gallon of milk feels exhausting, your grip strength is fading, one of the earliest markers of deficiency. Third are those painful nighttime leg cramps that jolt you awake. They happen because vitamin D regulates calcium flow in muscles, and without it, your muscles can't relax properly. You've probably been told that milk is the best source of vitamin D, but here's a disturbing truth the dairy industry doesn't want you to know. Most store-bought milk contains only about 100 IU of vitamin D per cup, a mere fraction of what seniors actually need. Even worse, skim milk removes the healthy fats that are essential for vitamin D absorption, rendering it practically useless for muscle protection. Many seniors drink glass after glass, believing they're doing something good for their bodies, while their muscles continue wasting away. The solution isn't complicated, but it does require taking the right kind of vitamin D in the proper amounts. Most multivitamins contain a paltry 400 IU of vitamin D, barely enough for a child, let alone a senior trying to preserve muscle mass. The National Institutes of Health now recommends 2,000 to 5,000 IU daily for adults over 60, with blood tests to monitor levels. A simple and affordable solution is vitamin D3 drops with K2. The liquid form absorbs much better than pills, especially for seniors with digestive changes. A high-quality brand costs about $10 per month, a small price to pay for preserving your strength and independence. Your diet plays a crucial role too, and there's one breakfast combination that works better than anything else for boosting vitamin D absorption. Eating 2 whole eggs, the yolks are where the vitamin D lives, with half an avocado provides the perfect combination of nutrients. The healthy fats in the avocado increase vitamin D absorption by up to 300%, according to a 2024 study in the Journal of Nutrition. One of our viewers, 83-year-old Carl, started eating this breakfast every morning, and after 3 months, he could finally lift his 15-pound dumbbells again, something he hadn't been able to do in nearly 5 years. Sunlight remains nature's best source of vitamin D, but there's a specific way seniors need to approach sun exposure. The key is midday sun, between 10 a.m. and 2 p.m., for just 10 to 15 minutes on bare arms and legs. Here's an easy trick to know if the sun is strong enough to help: look at your shadow. If it's shorter than you are tall, the sun's rays can produce vitamin D in your skin. If your shadow is longer than you are, the angle of the sun is too low to be effective. Many seniors make the mistake of sitting in late afternoon sun, wondering why they're not seeing benefits. Now you know why. If you take certain medications, you need to be extra careful with vitamin D supplementation. Blood thinners like warfarin interact with vitamin D in ways that can increase bleeding risk, unless balanced with vitamin K2. Diuretics or water pills flush out magnesium, a mineral that vitamin D desperately needs to function properly. If you're on these medications, adding 400 milligrams of magnesium glycinate at dinner can make all the difference. Always consult with your doctor, but don't let them dismiss your concerns. Insist on that 25-hydroxy vitamin D blood test to know exactly where you stand. Implementing a simple 30-day plan can literally transform your muscle strength. Start each morning with those 2 eggs and half an avocado. Take your 2000 IU of vitamin D3/K2 drops, place them directly on your tongue for fastest absorption, and include some fatty fish like salmon or sardines 3 times a week. In the evening, try a simple wall sit exercise. Just lean against the wall with knees bent at 90 degrees for 30 seconds to start. This gentle exercise boosts vitamin D receptors in your muscles, helping them utilize every bit of nutrition you provide. Avoid processed, fortified foods that use cheap vitamin D2 that seniors can't absorb well, and limit alcohol, which reduces vitamin D activation by up to 30% per drink. The proof is in the research. A 2024 Mayo Clinic study followed 500 seniors who corrected their vitamin D deficiencies. After just 90 days, participants showed 14% stronger grip strength, 42% fewer falls, and 68% regained their ability to climb stairs without assistance. These aren't small improvements, they're life-changing results that can mean the difference between living independently or needing assisted care. Margaret's story didn't end with just getting back to her gardening. Last month, she sent us a video of herself teaching her great-granddaughter how to do cartwheels, something she hadn't been able to do in nearly a decade. Her muscles remembered how to be strong once they got the vitamin D they needed. Your body wants to heal, wants to be strong, wants to keep you active and independent. It just needs the right tools, and now you know exactly what to provide. We want to help even more. Comment "strong" below, and we'll send you a free printable checklist of vitamin D-rich foods tailored specifically for seniors. Ask your doctor for that crucial 25-hydroxy vitamin D. Blood test. Optimal levels for muscle preservation are 40 to 60 nanograms per milliliter. And subscribe, because next week we're exposing the hospital breakfast that's shrinking seniors' muscles, with leaked documents that will shock you. This isn't just about vitamins or muscles, it's about maintaining your dignity, your independence, and your ability to enjoy life on your terms. Every month that passes without addressing this deficiency means more muscle loss that's harder to regain. Start today. Your future strong, capable self will thank you. And Margaret? She just celebrated her 80th birthday by hiking a nature trail with her family. With the right knowledge and action, that could be you too. Hit that like button so we can get this vital information to more seniors who need it together. We can fight this silent muscle thief.